All right. Hi there. Good afternoon, everyone. I am so glad that you're tuning in with Conversations with Carla. And I am tickled pink to have with us Dr. Deborah Ellis, who's going to be sharing her knowledge and her expertise with us. So tag a friend, tag a loved one. We're going to be talking about COVID-19. Many of you have not sure what information is correct. And I like to give people the opportunity to get the correct information. What you do with that afterwards is up to you. But information definitely is needed. And I'm grateful to have this wonderful source, Dr. Ellis, with us. So, Dr. Ellis, can you just introduce yourself, please, to our guests?
Sure. So I'm Dr. Deborah Ellis, and my PhD is particularly in public health, infectious disease epidemiology. So COVID and what is happening in a pandemic has been my world for the last 20 plus years.
Wow.
And so I'm the System Director of Infection Prevention and Control. And what does that really mean? It means that we make sure in a hospital that the instruments that are being reused on you, they're reprocessed and sterilized correctly. We make sure that when an infectious person comes into the hospital, that while we take care of you, you are not infecting the staff or the staff carrying it to another patient. So, which is why we say infection prevention and control. Because if we then have something that accidentally we didn't know, we find out later on, well, the doctors and the nurses call us and say, hey guys, come in, we had an exposure, we need you guys to now take care of it. So we are the behind the scenes people that have always been there, but COVID really has brought us into the spotlight because we are experts in everything around transmission, how to keep the patient safe, how to keep staff safe, knowing how to use the environment. We have to, something as simple you may not think about is the HVAC system. Well, how if it's spread, how are you keeping it from going out the door and that kind of stuff? So we are the experts in that when a sick person comes into the hospital with an infectious disease, it does not cause a catastrophe while we take care of them.
And I love that. My sister reminded me exactly of what the importance is for what you do. And my daughter had me practicing how to say epidemiologist. There was a story There's a story that my sister told years ago about here it was, there was people dying drinking this water, dying, and people wondering, you have different people along the spectrum trying to figure out or take care of the people once they're sick. But an epidemiologist, they go to look for the source. You are the ones who look to find why. You are the ones who nobody ever ask about, because people may be sick and going to the doctor, but you still need to find what the source is. And that's what's so important for what you do, and why I was especially pleased to have you speaking with our audience, because public health, nobody thinks about public health. But now,
and that's one of the good things I say about public health, because in other times when we didn't have a pandemic, if they gear you up for something, oh my goodness, we're going to have a huge outbreak, do this, get your vaccines, do all of this, and it's not going to happen. In the past, it didn't. And people would say, well, they got us all prepared for this and it didn't happen. In public health, we say, well, that means it worked. If you don't get it, it worked.
yes.
And so, yes, we are the people. And so the hospital epidemiologists are the go-between between the public health and the hospital. Because if you ever wonder, well, how does the federal government get all of this information? Mm-hmm. Well, you come into the ED, the epidemiologist takes the data, uploads it into the national database. The state has access to it. The county has access. then the state has access, and then the federal government has access. So we are that go-between, that liaison between what's happening on the front lines in the hospitals and getting the data pushed out to the appropriate people. So people that work, and you have public health epidemiologists and you have field epidemiologists. So my epidemiology is specific around just the hospital.
And I want to, for those of you who are old school, who don't know what ED is, because back in the day, it was the emergency room, ER, but they now call it ED, correct? So
that is correct. The emergency department, because it's not just a room, it's a whole department.
So I like how you share that. So technically, when someone goes into the ED, data is being collected. You guys have to know certain information so that you can run you can run the ball to see you could prevent anything else coming down. So guys, that's the time I just wanted you to specifically tune in, because what we're experiencing now as a country has many of us sharing some loved ones that have passed away, and some of us think that, oh, what's the big deal? And I don't want us to think about that. Now, the other part of our title was that infection preventionist. Tell me a little bit about that.
So the epidemiology part of it is that we take all of this data and we give feedback to the doctors. Okay, so infection prevention is the same thing, but in my hospital, we have a group of people that then walk around the hospital, infection preventionists. They will do what we call daily rounds and make sure any patient that has a certain diagnosis that they are appropriately what we call placed in precautions.
Okay.
Because what we do is, and we collect data, and then those folks, you interact with the frontline staff, with the doctor or with the nurse, because your number one defense system that people don't think about is your skin. Your skin is your number one defense system. So what do we do when you come into the hospital sick? We bypass that defense system. We put all kinds of tubes and needles and stuff in you. And what that does is that makes you vulnerable and creates a super highway directly into the body.
Wow.
So we go around and we audit and we make sure that the lines that a patient has is actually being managed appropriately to prevent from that line being a super highway for an infection, because you need that line to deliver medicine.
Yes.
And to deliver care. But the bugs are opportunistic, so they're going to find that way to get into the body the same way. So we have those measures and a lot of things in place to prevent that from happening. So we do daily rounds, we interact with the nurses, we interact with the doctors. And sometimes we get really busy and we forget a patient actually has a line, and we go and we ask the doctor, does that patient still need that line? And they go, yeah, no, we could take it out. Because every day a patient has a line increases their chances by 5% of getting an infection while in the hospital.
Oh, wow.
So we don't want that to happen.
I just
we look at antibiotics.
I think that information is so important, because I'm sure when people go to a hospital, they don't see a person like you. They may see the doctor, and we've been saluting those people who work and clean the hospital, but you never realize the importance of what your position is there in the hospital to make sure, because as we know, and you said it so nicely, that your defense systems are down. So you need to take those extra steps to make sure everything is good. But anyway, I love this. So we're going to go right into some questions. And guys, if you guys have any questions, feel free to put them in the chat, and I'll ask Dr. Ellis as we go along. But I want you to just tell us, what is COVID? So you have so many people. So can you share in some layman's terms, what is COVID-19?
Okay, so what is COVID? So first, when all of this started, let's go all the way back to December of 2019.
Okay.
Okay. All of a sudden we hear oh my goodness, there is this virus and it's spreading like wildfire and people are dying. So it's not that we didn't know of of coronavirus, which is what COVID is. It's a type of coronavirus. So coronaviruses are actually a group or a family of viruses, and we know quite a bit of them, quite a few of them. Only 4 is known for human transmission.
Mm-hmm.
Okay, and is it 4 or 3? 3. 3 are known for human transmission. 1, 2, 3, 3. Most coronaviruses are in animals, and animals could pass it on to other animals. Every now and then, what viruses do, which they're really good at doing, is rearranging their DNA. And all of a sudden, we will have what you call zoonosis. They will jump species, jump from, in this case, the bats into humans. And so humans, we have no defense. So it makes us sick. Okay. So going all the way back there, so then it started to spread. You started to hear, oh, it's not human to human transmission. Because even if you have a zoonosis or a zoonotic infection where it is jumped species from the animal into the human, the thought processes initially would be, you have to come in contact with that animal to get it. Mm-hmm. We run into problems when that then in the person becomes person-to-person transmission. Mm-hmm. I can give it to you, you can give it to someone else. You do not have to go back to the source. Mm-hmm. So when you get human-to-human transmission, what we try to do is figure out immediately, how is it transmitted? That's epidemiologists. We are not, as epidemiologists, we are really not as concerned as to what disease is it causing, as opposed to if it's person-to-person transmission, we need to know how that is happening.
Okay.
So there are 3 main ways that you can get viral or bacterial, just about any transmission of virus or bacteria. By contact. You have to contact that person directly, touch them directly, or indirectly. It falls onto a surface. You have to touch that surface and then put your hands to your nose, eyes, or mouth. That's one way. Then we have what we call droplet. And droplet means that when a person that has the infection actually sings, speaks, talks, sneezes, that droplet nuclei comes out of the mouth and the virus is in that minute droplet. And when that droplet goes into the ear, it is too heavy to stay suspended on the air currents for a long period of time. So it drops out of breathing space within 6 feet. Okay. Now you know where the 6 feet social distancing comes from?
Yes.
Because even if someone is infected and you're 6 feet away without a mask, it comes out of the breathing space within 6 feet, and your chances of getting infected has been lowered almost by 50% immediately.
Wow.
Okay. That's the magic of the 6 feet social distancing.
Okay.
Then we have airborne. And airborne means that once it is in the air, it could stay suspended on the air currents for a while. So some of those diseases that we have that are airborne, like a person, you could be in the room and you are sick with the disease. You leave the room and someone else coming into the room could actually inhale that virus and become sick.
Okay.
So viruses that work like that are chickenpox, measles, TB, a bacteria that works that way.
Okay.
So when we have a novel virus that comes out, which is what COVID was, a novel virus, we want to know, how is it transmitted? And so very early on, you probably heard the debate. It's airborne, it's droplet, it's airborne, it's droplet. And we always have that debate. But the majority of the times, any upper respiratory virus like common colds ends up being in the category of droplet. So
Okay.
this is why you're asked to wear your mask over your nose and your mouth. Your mouth, for the reason, if you are infected and you don't know, when you speak or talk or sing, it captures that virus and that droplet before it even has a chance to escape.
Mm-hmm.
And then over your nose is actually for yourself because it prevents you from having the droplet drop onto your nose and then you breathe it down into your lungs and your system. And so that's the categories where it says wash your hands.
Mm-hmm.
Keep your hands away from your eyes, nose, and mouth. Wear your mask over your mouth and your nose. Those are the strong prevention measures for the public that we in hospital epidemiology have always known because we get measles, chickenpox, and TB in the hospital all the time.
Mm-hmm.
So we've always known about that. So that's one of the ways we think about it.
Okay.
COVID, huh?
Oh,
So
go
COVID-19 just means it was a coronavirus that causes a disease, CO, coronavirus, disease, COV for virus, disease, and 19, just meaning that we discovered it in humans in 2019. That's where the name comes from, as simple as that.
Oh, wow. That is good to know. Again, that gives a specific era description for those of who us aren't familiar with that. So the COVID-19 and the corona, and I liked how you shared exactly the different ways how you can transmit it and why it's important. I've seen many people with the mask and they don't have it over their nose. They may just have it over their mouth. And I keep thinking when HIV came out, when people didn't want to use a condom or they said, oh, I'm going to pull out. I'm like, no, guys, you just don't use a half a condom or something. It's the same premise. You have to keep it on for the whole time. So your mask, your nose and your mouth, guys, for that.
Right.
Some people.
As a matter of fact, Carla,
mm-hmm.
In epidemiology, we say wearing your mask over your mouth and not your nose is the equivalent of putting on the condom and cutting off the tip.
I like that. Right. It's just like, why? You know? Oh, I don't feel comfortable with it. I still remember when I worked as a case manager, high risk pregnancies, and the girls would say, oh, the guys don't want to wear it. It's not comfortable. I'm like, you're going to have a baby for being charged for 18 years. I'm like, they could be uncomfortable for that 5 seconds or however long it may take. So wearing that mask, I like that, Dr. Ellis. Now, tell some of us about what are some of the symptoms that people may have if they have COVID-19.
Sure. So you get fever. It feels like you're coming down with the flu.
Okay.
Because guess what? We do have not quite a bit, but we have common flu virus that actually causes the common cold.
Mm-hmm.
And so or flu, and you feel lethargic, your muscles hurt, and because it's the flu, I don't know if you know the difference in getting the cold and the flu. A cold tends to come on gradually. A flu hits you like a Mack truck.
Okay.
You feel well at 11 o'clock, and by 2 p.m., you're telling your friend, take me home. Okay. And I tell people sometimes with a flu, a true flu virus, your eyelashes hurt.
Oh, wow. Everything
because your entire body is just fatigued. It hurts. You have muscle weakness. You can't walk. You can't stand. You get a high fever. You cough. With COVID, we've seen some cases of diarrhea. And then we've had cases where people say the first thing to go is their sense of taste or smell.
Okay.
And so those are the common ones. And what we do as epidemiologists in the hospital, we work with the IT department. What is IT called?
The
information technology.
Mm-hmm.
Yes. So when you come into the hospital, they screen you and ask these questions. And if you meet any of these questions, they immediately take action and place you somewhere that you are not infectious to be possible spread to someone else. And so we work there too, very much so, to make sure you are triaged correctly.
And again, that's important, so people don't take it offense or get offended when I know some people are perturbed when they're taking your temperature, when you go different places or go to your doctor's office or going everywhere. But as we're learning, it's the first step. And so they may do some additional steps afterwards, but it's all a part of being proactive instead of being reactive in many situations as we're learning. Now, you've already told us how it spreads. So what is the incubation period? Because some people are like, oh, I came across somebody, I'm fine. You guys are just overreacting. What is the incubation period here?
So that's a very good question, Carla. So we have learned that the incubation period could be anywhere from 5 days after you've been exposed up to 14 days after you've been exposed. Incubation period just means it's taken the virus a while to replicate so your body can feel that it has it, but you're already infected. You're not necessarily infectious as yet. But it does not mean that you came in contact with the person and you immediately become sick. It takes a while for the body to realize I have been infected and for that virus to replicate enough to actually make you sick. Now, the thing about COVID is that you can become infectious to someone else 2 days before you even know you're sick yourself.
Oh, can you repeat that?
Yes. The thing with COVID is up to 2 days before you yourself know that you're sick, you can be infectious, spread that virus to someone else. Okay? And COVID is not the only virus that does that. Chickenpox does that. Measles does that. With chickenpox and measles, you could be infectious to someone else up to 5 days before that rash or that first pox appears.
Oh, wow.
So viruses can get a little sneaky there. So this is why a national or everyone wear a mask, because you have people that are asymptomatic, so they develop no symptoms at all, but they can be infectious to someone else. And you have what we call it the infectious window. The infectious window opens 2 days before onset of illness.
Oh, that's a really great point to share, because you have people saying, well, oh, I was exposed and nothing happened to me. And again, they're operating in a single vacuum, not understanding that they can be asymptomatic with no symptoms, may not come with it, but they could be the carrier to someone else that you care about. And that could be so detrimental. I recently, a family friend, their great grandmother would have turned 95 in March, but a young person, one of their great grandchildren, who perceives that they knew they were exposed, but they felt they didn't have any symptoms, and they came into the home, and then she got it and she passed away, unfortunately. So, guys, I want you to take this seriously. I still remember when HIV came out, you had some people who felt, well, oh, if I have it, I don't care. I'm going to let somebody else get it too. And they had to start making some laws for people who knowingly went out to infect others. And I think we need to be responsible even with COVID-19 now. And just because you may have it or feel you don't care, that's sad, but please, pretend it was your mom, your dad, or someone you cared about, because you may not care about your mom and dad. So whoever it is you care about, just be careful with all of that. So how is COVID-19 being diagnosed?
So it is being diagnosed by testing. When the pandemic first started, because of HIV, you actually keep referring to HIV. Because of the HIV pandemic we had back in the early 1980s, the World Health Organization and some other organizations formed that if any novel virus or emergent, we call them emergent infectious diseases, that is caused with a new virus, the first scientific community to be able to sequence that virus must share it with the world.
Oh.
So, yes. So that came out of HIV. Okay. So this is why it was very important for China to immediately share that they had the virus sequence, the genome sequence. Once that genome sequence was known, everyone around the world, the scientific community, can then start developing tests against the virus to detect the virus. Now, people talk about tests and they're like, I want to get tested. I want to get tested. And there are so many different platforms, so many different types of assays that were developed for you to be able to test for the virus. And there is no test out there that is 100% perfect.
Okay.
In the scientific community, we stay away from 100%. Mm-hmm. We will say 99.99%. Mm-hmm. We will say 99.9%, but we will stay away from 100%. But anywhere you see 99.9% or 99.99%, that is the scientific community way of saying it's 100%.
Okay.
But we leave that infinitesimal window open just in case there is that 0.01% that proves us wrong.
Mm-hmm. I like that because, again, you're letting them know it's not infallible, but the facts are, the science is for this. But I also like what you shared about how the world works together so that the scientists, once they identify what do you call it? The
genomic sequence.
The genomic
sequence.
Wow.
Because every virus has a specific genomic sequence. And once you get that, you can start developing testing and you can start developing vaccines.
Yeah. So again, I didn't do well in my sciences at school, but I'm so glad that there are people out there that is their talent and their gifting to know that it's hard for me just to remember the DNA chromosomes and 20 whatever. I won't even try to do that. But now we know COVID has been serious and we know it can cause death. And I know the numbers have been increasing. Is there a tally as of now that you're aware of for those in the US?
Let me see. I had it pulled up here and let me see if I could. Nope. Okay, so globally now we're hitting almost 100. Let me see, that is million. We're almost hitting 100 million. Wow. In the U.S., confirmed cases is 25 million, and deaths we're a little over 400,000 deaths.
Oh, wow. And I know working in the hospital, and I know you're in California because I'd heard or saw something on the news one time where they said because of the COVID and the numbers that are increasing, ED rooms are being maxed out, and so therefore certain accidents or different things are occurring. Okay. It's being handled differently. Share with us a little bit how our disobedience as people for not wearing our masks affects us. I'm going to call it what it is. That person who thinks they can sneak out and do. How, because it's not affecting them right now, but the time may come when something happened and they realize the ripple effect because of us not taking this seriously and wearing our masks. So how has it been impacting the hospitals there in California?
So it's impacted not only the hospitals in California, but in other states also. And at the start of the pandemic, you heard the word flattening the curve. Mm-hmm. that means that the number of cases are exponentially going up. And it is going up faster and making people sick faster than the healthcare system can actually handle. We do not have unlimited resources and unlimited staff. So we have to be able to keep it at a curve, flatten it, make it go down or flatten it out so it's not rising exponentially, so that the healthcare system can take care of you. Well, because of over the holidays that are disobedience, we have now that the spikes have doubled. It's exponential number of spread that is occurring. And we are now in California, particularly in LA, we are practicing crisis medicine. Well, what does crisis medicine mean? It means when your paramedic comes to get you if you're sick, they do a total assessment on you and they assign a score based on this assessment. And if that score is too morbid, too high, they don't even take you to the hospital. Wow. Because the possibility of interventions to help you, the heroics that we would normally do, we don't have available anymore. Wow. Because you have to remember, we're being inundated with COVID positive motor vehicle accidents, diabetics that are in comas, gunshot wounds, stab wounds. None of these other illnesses, baby delivery, none of these other illnesses and things has stopped. So it's taking care of the normal things on top of COVID coming into the facility. Well, who works in the healthcare institutions? People. So they don't live in the hospital, they go back home. So the thing is, they have to quarantine if they were exposed, or they have to isolate if they were exposed and they get sick. So it's the perfect storm. The number of patients are rising that needs to be taken care of in the hospital, and the number of staff available to do so is going down because they are becoming infected also. So it is definitely not a just me, I am not doing anything, I can go out, I'm not going to pay attention to that. No, it causes a huge ripple effect because what is happening now, we are having so many deaths that the morgues are overwhelmed. So you have to get refrigerated trucks. Well, refrigerated trucks hold your loved one's body until the morticianer can get to it. The morticianers are overwhelmed, so they are telling families it's going to be another month before we can actually get to your loved one to bury them. Wow. So it is a very long ripple effect that we don't think about all the time. And supplies. The hospitals may only have, even if we augment our supplies, we do that same scoring system, and crisis medicine actually grew out of our triage medicine in the field with wars. Okay. If you have so many injured soldiers, you have to know with the resources that you have, which soldier will benefit from them, you actually doing some heroics, and which one you can't. Another example of crisis medicine is when we had here in Las Vegas, which I'm in Las Vegas right now. Here in Las Vegas, we had the mass shooting. Those kind of things. When you have so many people overwhelming the system, you get a tag. They can help. They can rush you in, rush you. They triage you, and some people, you just don't have anything for the intervention, and they're possibly, the risk is high that they're not going to survive. So then you just get parked to the corner. Wow. Yeah, so that's where we are in many hospitals.
I hope you guys hear that, because you may think it's okay, but think if it was your loved one who just got in a car accident under normal circumstances, if we didn't have the hospital staff and the beds full, they would make an effort, like she said, a heroic effort to try to save your loved one, and possibly they would make it. But because of the different supply and demand, it is what it's going to be. So you may think that you're not affected by it, but as if you live long enough through this, you will see how you are affected with it. So my goal in bringing Dr. Ellis here was really to educate us and understand the importance of it, and to help us with some myths and foolishness that we hear. So talking about foolishness that we hear, please tell us about the COVID-19 vaccine, because talk about people who just,
Okay.
I know my community sometimes are fearful about different things, but please educate us on the COVID-19 vaccine.
Okay. Sure. So, like I said, as soon as a genomic type-in is available, all the scientists in the scientist community gets to working around the world. And it is now a race to get it test and to get vaccines out there. In the US and across the world, there are some very, very strict vetting that all vaccines have to go through. Now, people are saying, well, this was done very quickly. Usually, when you go through the vetting process, what happens is you do each of the phases consecutively, one after the other. Because there was nothing out there when we had such massive morbidity and mortality, you are allowed as a vaccine developer to do all of the phases concurrently.
Okay.
All at the same time. So nothing was cut short. No steps were cut short to develop the vaccine. And for each phase that the vaccine developer did trials, and the FDA, the Federal Drug Administration, would not allow a trial on humans to start. They first have to do it on animals, mice, then the various steps. So that was done. And for each, the FDA looks at the data and then says, okay, it's ready to go to humans now. And humans then volunteer. So what you hear a lot of, especially in the African American community, we tend not to participate in clinical trials, because the first thing you hear in the African American community is Tuskegee. And that debacle, that whole thing that happened, what I like to remind people of is with the Tuskegee study, they weren't putting anything into the patient's body. They were withholding treatment that was known to be effective. They were not giving it to them.
Oh.
They were withholding.
Oh.
Once we knew that penicillin was able to kill syphilis, they said, and it was a very small group of researchers in a very small space, we are not going to give them the antibiotic. We are going to look and see how the disease progresses.
Oh, wow.
So they used them to see how the disease progressed. So they weren't putting anything into their bodies. They were withholding the effective treatment. Here, in vaccines, we have the effective treatment. And we are begging you to get the effective prevention. I'm sorry. The effective prevention is what we're asking for. Going back to the development of vaccines and other things, once it is law. This is why that whole study became known and that kind of stuff. And there's a lot of laws that grew out of that, including informed consent. And once you are participating in a study or you're receiving any medicine, you ever pick up your medicine from the pharmacy lately? How
Yes.
much paperwork comes along with that?
Yes. Mm-hmm.
Okay.
Mm-hmm.
Right. It is full transparency, and there are many, many, many layers of tracking and following and data collection and aggregating the data that occurs.
Okay.
So the thing, go ahead.
I have a
I'm sorry.
question that somebody's asking. What's the point of taking the
Sure.
vaccine if they still have to wear a mask?
Excellent question. Once you get the vaccine, your body takes a little while to recognize the protein, which is what the vaccine is made from, to recognize the spike protein and develop antibodies against it. That's how you get your immunity. So
Mm-hmm.
it takes a while, just like the infection takes a while, the body takes a while to catch up. So
Mm-hmm.
we do not know yet if while you are developing antibodies, if you can become infectious to someone else. We
Mm.
don't know.
Okay.
Okay. So you wear your mask, and because we have asymptomatic persons still walking around who probably didn't get the vaccine, who is going to be the mass police to know whether you got the vaccine or not? I know some people are starting to walk around with the vaccine cards and that kind of stuff. That eventually will go away. That will
Okay.
eventually will go away, because for any particular disease that has a vaccine, you need to have a certain percentage of the community immune before the virus cannot find another susceptible host and it eventually dies out. That's where you have heard the term herd immunity. So
Mm.
many people already are immune to it now. The virus has no new person to go into to cause the illness, and it eventually. So, what will happen going forward? We have what you call endemic numbers. It
Mm-hmm.
will never get back to zero, but it will be low enough because we have so many people that are now immune, whether they got the illness or they got the vaccine. You have
Mm-hmm.
that immunity.
Okay. Awesome. So I know we kind of touched already on how the vaccine developed so quickly, even though we realize now that some of the things were happening concurrently. So therefore, that's a come we were able to just understand the need to have that out. I'm posting a website that Dr. Ellis shared with me that you could definitely follow for different information. The Hopkins medicine.org website on the coronavirus and the vaccine, and it's the safety with taking that. One of the questions that I wanted to ask to our current president, Biden, are there any new things or anything that you've heard that may be rolling out to us? And can you share that with us, please?
Sure. So I probably could share with you another website, but there's a website, and Moderna and Pfizer are not the only two vaccine manufacturers that we will have. As a
Mhm.
matter of fact, there are probably 17 to 20 vaccine manufacturers. Pfizer and Moderna just happen to be the first one to finish their clinical trials and get that emergency use authorization to
Mhm.
go through. But across the world, we continue to have vaccine approvals to roll out. If the data must be reviewed for us to know the efficacy and the safety for us to move forward. So we probably very shortly will see additional manufacturers of vaccines. We will see those doses hit the market. Under the prior administration, how the vaccine rollout occurred is that the federal government bought up so many from the private company. And then the federal government distributed those vaccines to the state. Then the state distributed those vaccines to the county. And then the county distributed those vaccines to the front line, the healthcare, the hospitals, the doctor's offices, and that kind of stuff. Now, from a public health perspective, because COVID is not the only thing that we think about when we think about a pandemic or an epidemic. We have to be prepared, and public health in the US, we have steps that are taken. And it has always been, if we run into a situation like what we are in now, that the people that will be first in line to get the vaccine are your first responders. Mm-hmm. Because when you think about it, we are asking these people to leave their own vulnerable family at home and come to take care of you. Mm-hmm. So the best we can do is give them the protection first so they can take care of you. Mm-hmm. So think about that when I've heard on social media and other places, well, why do they get it first? And, you are asking me to leave my family and come take care of you. Mm-hmm. My family is just as vulnerable. Mm-hmm. Okay, so that was that. And then we started rolling out to other high-risk groups. Mm-hmm. And so now what we're going to do under the Biden administration, you heard them talk about engaging the National Guard and that kind of stuff, is instead of having that supply chain, we're going to cut out all of that middleman and get it straight from the manufacturer to the federal government, to the sites that they're going to be setting up for the mass vaccinations, because we need to get it into arms. Mm-hmm. It's not good enough that the stockpile is available. It's not good enough that we have it in storage. It's not good enough. We need to get it into arms, because the faster we develop immunity, the sooner we get over this pandemic, the sooner we get back to normal life.
Excellent. Oh, I love that. I have a couple of questions here. Lavina is asking, why do some people who are asymptomatic test positive for COVID-19?
Excellent question. Asymptomatic just means that you are not showing any symptoms. It does not mean that you're not infected. So your test is actually picking up that you're infected. You're just not exhibiting any of the typical symptoms. Okay. That's what asymptomatic means. Excellent. So yes, you can test positive for, although you are not showing any symptoms.
Lewis says here, there have been cases of a false positive or false negative. Is there a test that is more reliable?
Excellent question again. Remember earlier we talked about the various types of tests, and no test is 100% 100% reliable. So we have what we call in laboratory medicine, we call it the PPV and the NPV. The positive predictive value and the negative predictive value. And we calculate that, and we know out of 100,000 people that are tested, this particular test can actually say you're positive when you're not. That's a false positive. And this particular test can say you're negative when you're actually positive. Mm-hmm. What we call the gold standard is what people refer to as PCR. What that does, that same genomic sequencing we talked about, it takes your sample, looks for that genomic sequence, makes replication of that genomic sequence, so many cycle replications of it, and then you add a substance to test and see if that genomic sequence is present. And if it's present, your test will come back, and it wouldn't say positive or negative. It will say detected or not detected. So there is a possibility that you could get tested too soon. Your body has not had enough viruses in it to replicate for the test to be able to pick it up. Or there was something else in the sample collection, the pre-analytical phase, to get it into the laboratory for it to actually be tested. So there are a lot of variables that can happen. And again, no test, even at the gold standard, is 100% reliable. You always have that small portion of it that's not reliable in a general population. So we calculate that, and the test on the market could be anywhere from 80% to 95%. So you still have that small amount where you can actually test and it's not a true positive or negative.
And I just want to share with that, for some of you, you know how when you may take a pregnancy test and it says you're not, but then later on you may. But so again, I like when they say, when you said the vowels, or when you have a irregular way of conjugating a verb, there's an exception to the rule sometimes. And as Dr. Ellis said earlier, there's no such thing as 100%. So you could be that one that, hey, they say you weren't pregnant, but you are. 9 months later, you have pop out a baby. So keep that in mind. And so don't throw away the whole science behind it, because you may have met one or two people who were the exception, and they're not the rule. It's not following the rule, but the rule is, this is it. So we have another question for you, Dr. Ellis, from Dia. She says,
Sure.
How much longer do you believe the virus will be around? Is there any way of knowing that?
And so as an epidemiologist, this is why I said we will get down from it being a pandemic, meaning it's worldwide, and we will get down to never zero. It will not ever be zero again. You will hear of small outbreaks or small clusters or small numbers of persons. It will continue to be a reportable, and you'll hear of small numbers of persons that get the disease. Just like we have measles and chickenpox, and we have vaccines for them, and we do have herd immunity for those diseases, but you still hear about small outbreaks and small clusters of those diseases. So I would read into your question, how much longer do you believe the virus will be causing a pandemic? If I'm actually looking at the last pandemic the world actually experienced, which was the 1918 pandemic, it took about 2 years before things started to get back to normal and the numbers started to go down. But back then, they did not have the vaccine. So this is why we're saying we want you to get the vaccine, because the faster those that have been positive and sick, and the faster we get the vaccines out there, the sooner back to normal life. So we are looking at the numbers and using projection models. We're going to start to see the numbers go down probably about June, July. We're going to start to see the numbers start to go low, go down. In public health, you have to have low enough numbers to then say, and sustained for a while, not up spikes again, spike and go up, sustained lowered numbers for up to 3 months before we can say we are now getting to the post part of the pandemic or the disease.
Okay.
Dia so use a lot of predictive models on that.
Okay, because Dia had another question that I know many are having. What are your thoughts with students and teachers in school? Do you think it's safe?
So what we have seen is that the virus does not exhibit itself in disease in children. Definitely, they are carriers. So I wouldn't worry so much about the student-to-student interaction. It's the student-to-teacher interaction. And as teachers know, children are little germ factories, because COVID aside, okay, you always know you had to be very extra careful around flu season, because the children will come to school sick and they bounce back very easy. There you go. However, some things that you could remind students of: frequent hand hygiene. Don't lick anybody. Yes, yes. Frequent hand hygiene and teaching them cough and sneeze etiquette into your elbow. The reason for that is when you sneeze and cough into your hand, what's the first thing we do when we greet people? Mm-hmm. We extend that same hand, mm-hmm. okay? Or we touch things with that same hand. Mm-hmm. So what we've done now is the second group of people that vaccines are going to be available to is not only the vulnerable and first responders, at least in California. I don't know if it will become national, but at least in California, that next group are teachers. Teachers are included in that group. Mm-hmm. While you're a teacher in school, primary prevention is wear your mask over your nose and mouth, keep your hands away from your eyes, nose, and mouth. Or I saw a meme that says, stay away from men, MEN, mouths, eyes, and nose. Just remember that.
Yes.
And frequent hand hygiene. You cannot overemphasize frequent hand hygiene. Mm-hmm. Those are the very, and cleaning of your space, disinfection of your space is very important also. In prevention, if I were a teacher, I would do that extra step that we take in the hospitals, which is not only your mask, but your face shield. Mm-hmm. I would take that extra step.
Okay.
And of course, you already have kids that social distancing also.
Mm-hmm. Yeah. So guys, I am so excited for those of you who have joined us for this wonderful discussion and for the questions that you have. Those of you who are listening to it on the replay or on my YouTube channel, thank you, because the more knowledge we have, there's something that Dr. Ellis said to me the other day when we were just getting ready for this. You said there were 3 things. Can you share that little nugget there? Because I told her I'm going to steal it eventually. The things that we were talking about Solomon, the 3 things that Solomon actually.
Oh, yes. So when God approached Solomon, notice that he said, what do you want? And Solomon was very specific. He said, I want wisdom, knowledge, and understanding. 3 very separate things. These days, we have a lot of knowledge. We are in the information age, and there's a lot of knowledge out there. Then we have you're like, oh yeah, you have a lot of educated idiots. You've heard that too. They have no understanding. But the thing I find lacking a lot of these days is wisdom. And sometimes old people without a lot of knowledge and without a lot of understanding had great wisdom. Mm-hmm. And I think part of it is in that same Bible, it tells us, for the fear of God is the beginning of wisdom. Mm-hmm. We have no wisdom, or we are lacking wisdom because we no longer, and in that text, fear means the knowledge of God. Mm-hmm. That we don't have an understanding of everything. There are some things we don't understand and we have no knowledge of. Mm-hmm. But we have to trust that in the wisdom of what it's saying that we should do, and particularly in COVID, for prevention.
Yes. Because I just like that, guys. Wisdom, knowledge, and understanding. And I told her that's a trifecta, because we've met many people who we say, oh, don't have common sense. They may be, brilliant, but that wisdom. And so what I'm asking for each of you during this season is to have some wisdom. And that is, I am a Christian. I do believe in the Creator and whoever you believe in, but that He gives us wisdom. He is the source of wisdom so that we can understand and know when to trust the science. And when He puts things out there, He's the one that did gravity, all these other things that don't make sense to us. And I just want to say, I hear many people talking about, oh, they don't want to do the vaccine or whatever, but many of us eat food that we don't know what's in. many of us take our other Viagra, whatever other stuff you take, you do, and they have different things for something that's going to save your life. I remember as a child going into the play yard and they lined us up to give us our vaccine. You know, it was just something you did so that you can protect society and the family. And so the COVID-19 vaccine is just another way of us protecting ourselves and our loved ones so we can be around to fulfill some purpose that we have. Now, Lavina says, Dr. Ellis is powerful of delivering clear and understandable information to the public. Must get this information out and printed. Thank you so much, Lavina. Louis Lindita says, excellent presentation. Thank you for your clear answers. And Lavina, thank you, Dr. Ellis. So, guys, thank you for taking a small part of your day out to be with us today. Feel free to tag somebody, share this particular presentation to someone else who may be hesitant about getting the vaccine or making sure they wear their mask and wear it over correctly, and to be informed about these different things because of all the stuff that's been happening with COVID. You know, I've had a friend who lost her husband. I've had a friend who's lost their only child due to COVID. I've had a friend who lost her father due to COVID. So I know many of you have been experiencing that. And so I've actually touched base with Crystal Spencer. She's going to be our guest in 2 weeks, and she has a grief ministry, and she'll share her story with grief and why she decided to do a grief ministry. But I do know that many of you have been touched with just regular life with grief, and now compounded with the loss of loved ones with COVID-19. So mark your calendar to join me on February 7th in 2 weeks to just talk about grief. And because it could be lonely out there, guys, when you have lost someone. And I don't believe in being a strong woman. I don't. I think that is a bunch of baloney that somebody created, because I'm like, I don't mind being weak and showing my emotions and having my breakdown and having my pity party and my crying and going on. And but it's just always wonderful for someone to just hear me, to sit with me.
So here is how Carla, here is how I actually say that. You know what? If God wanted us to be strong all the time, he would not have placed people around us that are professionals in psychology and grief counseling.
Yes, yes. And that's what we need.
He provides us the resources that we need.
Because just like he's provided the science for us for COVID, he's presenting the people who we can reach out to, the professionals, to help us through this. You do not have to go through it alone. We are not an island to ourselves. And so definitely tune in. But Dr. Ellis, as we wrap up, I put the one resource you told me about. Is there any other resource that you want to share with them, that if they want to, and somebody says any contact or to follow you? I don't know if you have any social media where how they can follow you or contact you. So
I'm old, Carla. I don't know about this social media stuff.
No, for people.
yeah. The most social media I'm on is LinkedIn. Okay,
right.
I'll have to actually start looking at getting a Facebook page and that kind of stuff. Don't even ask me how to operate YouTube.
I know we were doing our thing in StreamYard. So, but again, guys, again, I put the little link she told me about, the Hopkins medicine. It's there for you guys to click on to get more information. So choose to be informed. Don't choose to live in fear. Don't choose to live with myths. I remember my grandfather said, oh yeah, you don't walk under a ladder, or you don't look into a broken mirror. Guys, we've come a long way. Let's let go of the myths and all of those things and be informed. And thank you again, Dr. Ellis, for sharing this.
Thank you for having me.
All right, guys. Until next time, you guys have a good one.